My name is Jennifer Voss, and I'm a board certified and licensed professional music therapist. Often when I tell people what I do, I get a lot of responses that seem very interested and a lot of questions along with that too. So in today's video, I'm going to be sharing some commonly asked questions about the field of music therapy and provide you with resources where you can look for more information if this is a topic of interest for you. Let's start by defining music therapy. The American Music Therapy Association defines music therapy as the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. In other words, music therapists are highly trained professionals skilled in the art of using all aspects of music to help individuals make positive changes toward health or educational goals. A qualified music therapist will have completed their academic and clinical training, passed the board certification exam, and used the professional designation MTBC, which stands for Music Therapist Board Certified. Thereafter, they're required to complete at least 100 CEU credits every 5-year cycle in order to maintain their certification. Music therapist qualifications are unique in that not only are we required to be professionally trained musicians, but we also have comprehensive training and experience in practical applications of biology, anatomy, psychology, and the social and behavioral sciences. In addition to the academic coursework, a music therapist student will also complete over 1,200 hours of clinical training. In many states, including Oklahoma, additional licensure is required to protect the health and safety of those being served. There's no denying how powerful music can be. It can raise our heart rates or our respiratory rates. It brings up emotions and memories that are associated with the music. Music therapists are trained how to identify and respond to adverse reactions and to help the individual cope and process these responses. Music can also be a very stimulating sensory experience, which could be very overwhelming or stressful for certain people. And a music therapist, again, is going to identify and adapt to the cues of those individuals that we're working with during these music experiences so that they are able to participate in a way that's safe, as well as the most effective manner for that individual. Music therapists are constantly assessing, evaluating, and treatment planning as part of our regular procedures. And while everyone can use music and it can be beneficial, music therapists are trained to specifically apply music in ways that facilitate specific positive outcomes. So what is a typical music therapy session like? Well, the short answer is that there's not one size fits all. In this case, music therapists are conducting assessments and developing individualized treatment plans. It means that we're actively creating music, applying music, manipulating various elements of the music through live music, improvised, sometimes adapted, sometimes recorded, to meet the specific needs of the individuals that we're working with, whether that be a health need or an educational need. Therefore, there isn't really a one-size-fits-all. We have all different backgrounds and preferences and experiences with music, and we as music therapists take that all into consideration. We structure both instrumental and vocal music strategies to facilitate change and assist clients to achieve functional outcomes that are related to their needs. Music therapists today work with a wide variety of ages and abilities of individuals, from those who are premature in the neonatal intensive care unit all the way through the end of life. The people we work with have varying strengths, varying challenges, different ability levels, and a qualified music therapist can assess and determine if music would be a beneficial and effective modality of treatment for that person. The future of music therapy is quite exciting. Research is ongoing, and there continues to be new evidence documenting the effects that music has on us. Also, as a result of the pandemic, new frontiers have been forged through technology and telehealth that are opening even more ways and more opportunities for making services available to even more individuals in new and exciting ways. So really, it's a very exciting time to be a music therapist or to be training to be a music therapist because things are changing and growing so much. I hope this information that I've shared today has answered some of the questions that you may have had about the field of music therapy. If you'd like to learn more, you can visit the American Music Therapy Association website at www.musictherapy.org. There, you can find specific information about training in which universities offer a music therapy program. You can find research and bibliographies related to specific populations, as well as you can find a music therapist and see if there happens to be a qualified professional in your area.